Hi guys, this one case study is created by Nadine McLeachley and myself, Rahim Adanafua. First, we're going to start off by giving you a background about this patient. He is a 68-year-old male who lives at home with his wife in a two-family house. They are both retired, and he now is the primary caregiver of his wife, who is diagnosed with early dementia. He takes care of his wife while he is battling with congestive heart failure as well as chronic obstructive pulmonary disease exacerbation. At the age of 13, he lost his father to a car crash. His father was the primary caregiver of his family, so after his death, things changed dramatically. His mother started working two jobs in order to make ends meet. So as a result of that, she didn't have much time for him. As a result of that, he started smoking. By the age of 20, he smoked at least one pack of cigarettes a day. Smoking was a way for him to cope with his father's death as well as his mother not being able to have time for him due to her job. Also, living in a community where smoking and drinking was a normal daily lifestyle made it easier for him to fall into that lifestyle. He also started working at an early age because his mother couldn't provide for him as much as she used to while his father was still alive. Working and trying to cope with school added a lot of stress into his life. But he was still able to graduate high school and get his diploma. At the age of 22, he began working at the postal office. 2 years later, he met his wife. They got married 4 years later after finding out that she was pregnant with twin daughters. The news of his wife's pregnancy added more stress to his life, being that he wasn't financially stable to take care of three new individuals. But the love that he had for his wife and kids made him work even harder so he could keep his family happy as well as help his mother out. One way he coped with his situations was to smoke even more and drink once in a while as well. Now his daughters are in their early 40s, married with children, and both live out of state. He hangs out with his friends on occasions once in a while. He has bilateral weeping edema as well as a wound on his left leg as well. As we mentioned earlier, the patient has endured a lot of stress due to the death of his father, which caused him to have high blood pressure. Having high blood pressure causes the heart to overwork itself, therefore making it become weaker than normal. As a result of this, the kidneys may respond by retaining fluids in the body. Fluid buildup in the body is what causes edema as well as congestive heart failure. His smoking history also affects his heart. Smoking affects the body because we don't receive as much oxygen and parts of the body that we need. Therefore, fluid builds up as well in the body. Not having adequate oxygen in certain parts of the body causes organ failures and other system failures. One afternoon, while taking a walk around the neighborhood with his wife, he was bit by a dog on the outside edge of his left leg. The wound caused him to have excruciating pain. It started off small, but then increased as weeks went by. The wound now measures 5.8 by 2.5 by 0.3 centimeters. The wound tissue is 70% red granulation and 30% yellow. The peri-wound tissue is macerated due to heavy serious drainage that is a result of an infection. His legs are weepy and he is having a hard time keeping them dry because of the drainage. The wound has a low to mild odor, and the patient complains of a burning pain of 9 out of 10 on a pain intensity scale. This patient has left the wound open for weeks now, not taking good care of it, which may have increased in the infection, as well as the dog might not have received his rabies shot.
Dressing options. What type of wound care dressing is right for the wound? Characteristics of the wound need to be reassessed to know how to proceed. The patient's wound measures 5.8 by 2.5 by 0.3 centimeters. The wound tissue is 70% red granulation tissue and 30% yellow. The peri-wound tissue is macerated due to heavy serous drainage. The wound has a low to mild odor. These characteristics, when analyzed, indicate that the wound has an infection. For this reason, we believe that Hydrofera Blue is the best primary dressing option for the wound. Hydrofera Blue is constructed of polyvinyl alcohol sponge, complex with 2 organic pigments that provide a broad-spectrum bacteriostatic protection. Advantages of using Hydrofera Blue include that it is highly absorptive. It pulls bacteria-laden exudate up and away from the wound, which may facilitate healing and aid in patient comfort. It maintains similar or superior absorbency as compared to other highly absorptive dressings. It is also beneficial because it can be indicated and used for many different types of wounds, which include pressure ulcers, diabetic ulcers, venous stasis ulcers, arterial ulcers, superficial burns, post-surgical incisions, trauma wounds, abrasions, and lacerations. Another benefit of Hydrofera Blue is that it helps a patient avoid infection of open wounds in a convenient manner. Hydrofera Blue is also beneficial because of its longevity. It can be worn for an average of 3 to 7 days before it needs to be changed. It also has antibacterial properties that can help diminish any signs of infection in the wound, as well as prevent further types during the wound's healing process. There are generally no risks associated with the use of Hydrofera Blue. The second dressing is a foam dressing, and it is made of a semi-permeable polyurethane, so they are non-adherent and non-linting. And the dressing allows water vapor to enter but keeps out bacteria and other contaminants. The outer layer may be waterproof or hydrophobic. Foam dressings are generally meant for partial to full thickness wounds that have moderate or more drainage. Different types of foam dressings include Melaplex, Alovan, and Polyderm. Some benefits of foam dressing include that they are easy to apply and remove, not sticking to the wound. Also, they provide a barrier against bacteria. They can be used in case of infection. They are suitable for wounds with hypergranulation. They may be used during compression therapy. They provide a moist environment for wound healing. Can be used with infected wounds, and they provide cushioning. Some risk of using foam dressings are that the wound might dry out if there is too little exudate to be absorbed. Also, maceration of the surrounding skin can occur if it becomes saturated with exudate. And these dressings are not suitable for third-degree burns, sinus tracts, or wounds with dry eschar. The patient's wound has 20% necrotic tissue. This will be harmful for the wound as it tries to move forward with the wound healing process. Debridement is the removal of the damaged tissue or foreign objects from a wound. We believe that the patient is a candidate for autolytic debridement because it will allow the wound to heal itself at its own pace. With autolytic debridement, the body uses its own enzymes and moisture to rehydrate, soften, and finally liquefy hard eschar and slaw. Autolytic debridement is selective. Only necrotic tissue is liquefied. Autolytic debridement is painless for the patient. It can be achieved with the use of occlusive or semi-occlusive dressings, which maintain wound fluid in contact with the necrotic tissue. Autolytic debridement can be achieved with hydrocolloids, hydrogels, and transparent films. We also think that the patient should use mechanical debridement in order to allow the wound to heal. Mechanical debridement would allow the hydration of the wound. It would keep the wound at a normal drainage level, and it would remove debris. Mechanical debridement uses external force to break the adhesive force of necrotic tissue. There are different types of mechanical debridement. They include wound irrigation, which involves electrically powered pump system which delivers high volume of irrigation solution to the wound. It also includes hydrotherapy, which uses exercise in a pool as part of a treatment for conditions like arthritis and partial paralysis. It also includes ultrasound mist or mist therapy, which uses an ultrasound being delivered through saline mist to the wound. Wave stimulates cells to accelerate the healing process. And there is also wet to dry, which is the most common of the mechanical debridement treatments. With wet to dry, dressings are applied to the wound and then they're regularly changed throughout the healing process. The dressings start off wet and they slowly dry with the tissue. When the dressing is removed, necrotic tissue is removed along with it. Mechanical debridement can be inexpensive but can be more painful than other methods. We believe that these two types of debridement working in conjunction can promote the healing of this patient's wound.
How to holistically care for this patient. This patient will be visited by the wound care nurse Monday through Friday to change the wound dressing as well as monitor the wound. The wound care nurse would encourage the patient to stay off his feet so that he wouldn't put extra pressure on his leg in order to reduce the pain he is experiencing. Being that the patient is going to be off his feet, a home health aide nurse will be assigned to him in order to keep the house in order, as well as any other care around the house that he might need, as well as his wife. The patient would also be advised to stop smoking. Cigarette smoking delays the healing process. It makes it harder for blood to flow through the body. So quitting cigarette would be one important thing that this patient has to go through, as well as having important diet. Also, it is important to involve his family and friends in his life as well to reduce some of the stress that he goes through dealing with his wife who has dementia. Releasing stress has a huge impact on healing wounds as well as making the body feel much better than it is now. Having family around and having friends around would definitely help with the healing process. This patient isn't bed bound, but it would be good for him to stay off his feet like we mentioned earlier. And if he does need to get around, he should be on a wheelchair and he's able to mobilize the wheelchair himself. Or he could have a walker. The patient it would be a good idea for the patient to move out of his two-family house because it has stairs, and in his condition, he isn't capable of walking upstairs to get into his home. So it would be better for him to either move to the basement of a house or into a house without stairs. The wound seems to be healing okay, being that it is 7% granulation, since it has 7% granulation tissue. But we also need to be careful of the mild odor that he still has and make sure the infection doesn't increase. After implementing some of the nursing interventions, such as encouraging the patient to stop smoking, providing the patient with a home health aide, as well as checking the wounds and monitoring the wound for proper healing, the patient seems to be doing better. The edema in his leg has reduced by 5% within the past week. He seems to also be in better spirit. His daughters, as well as other family members and friends, also visit him more often, which reduces his stress, and he doesn't think as much anymore. So overall, we're expecting the patient to have recovery within the next month or so. Thanks for listening. I hope you learned as much as we did.